Hello everyone, welcome to another episode of Before and Beyond. Now today I want to talk about gum lines and how they affect the smile. Because it's actually really important that the gum lines are even, it's symmetrical. It plays a lot into how we perceive a smile. If we look at this photo, you can see that this patient has a very nice smile. And the teeth are straight, so it's very nice. But also because it's very symmetrical, and these are all natural teeth, it's not veneers, it's all natural teeth. Some teeth are a bit shorter, like this one is a bit shorter, but we don't really see it that much. Compared to this is touching the lip. We don't really see it that much because most of them are symmetrical, and the gum line is also touching the lips, just nice. So there isn't a space between your lips and your gums. Normally we want this to be either no space, which is 0 mm between the lips and the teeth, or it can be to 2 mm of gum showing between the lip and the teeth. And also relative to each other, left and right tooth, like the mirror image tooth, it should also be symmetrical or roughly symmetrical, because our eye picks up all the little asymmetries and then we identify them as not being very pleasing to the eye aesthetically. I'll show you some examples of teeth where the gum line or the gum show may be unbalanced, or maybe a bit more excessive than what the sort of norm is. And then we can see how it affects the beauty perception. So this is a case of excessive gum, and also she also has a lip tie, which causes her lips to be put down over here. So over here, that's the lip tie. And also, she has got a lot of gum show when she smiles. You can see there's a lot of gums between her lip and the teeth. There's a very big distance here. Yep, to here. And here to here. So we will call this a gummy smile usually. Usually it's perceived as not being very aesthetic. Also, on the teeth, you can see the outline of the tooth, of the gum on the tooth is like this. So it's not a nice curve. Usually we want like a very sort of arc, a very even arc over the tooth. And so the gum, you can see, is actually uneven. There's excessive gum on the tooth itself as well. So in the treatment, we also have to consider, after we straighten the teeth, the gums stay the same as how they were before. So the gums do not actually form a nice arc by themselves. So in order for this, actually both these teeth, to look more symmetrical, a little bit of that excessive gum may be trimmed away during the treatment. In this case, this patient had the lip tie, so we plan to have a laser surgery to remove the lip tie. I talk more about this in my lip tie video. And while we were at it as well, actually the procedure for the lip tie is a very straightforward procedure. It's in the clinic under local anesthesia on the area, and we use a laser to relieve the tension that is pulling down the lip, and also the excess tissue that is over here, as well as we can also do a little bit of we call this gingivectomy, or removal of the excess gum around the tooth as well. So after we straighten the teeth, then that can look a lot more even, symmetrical, and aesthetic. This is another case. You can see the teeth, the smile doesn't look too bad, but there's a few things which is causing it to look more uneven. One is the gum line on this tooth is a bit lower than the one on the opposing side as well. And if we compare to the front teeth, the gum line is around here, whereas this one is much lower, and then the one next door is much higher. So there's a bit of an unevenness that we see as we go along the left side. Compared to the right side, it looks more even because the gum line is roughly the same on that side. So although the tooth is a lot shorter on this one as well, you can see where I'm pointing, compared to this one, we actually see, I think, the gum line more, and then we notice that, oh, this tooth is really quite small. And then we see like, oh, the difference between the left and right is quite apparent. There's this imbalance or asymmetry that we pick up on. So as we do the treatment plan, we also have to consider how we can improve this gum line to make the smile look better. It's not just about straightening the teeth. It's more of the overall as well, how it displays in the smile, how we can improve it as we move the teeth. So these considerations are very, very important when you start your treatment plan for your patients. And also when you go to your doctor, make sure they are talking about your gum lines. Make sure they are looking at your lip lines, how much gum is showing when you smile. And not just a static photo. That means when you smile in one photo, how does it look? You should be looking at when you smile excessively, when it's a spontaneous smile, it's a big smile, how does it look? When you're speaking, how does it look? This sort of dynamic movement is very important to sort of consider in the overall aesthetics when you are trying to improve your smile. Because we don't smile just in one way. We don't smile like just a pose. They smile all the time, right? We are speaking, we are moving our lips, and how the teeth look and displays the gum line is very important in that. This is another case, very young patient. You can see, again, the teeth are straight, but the teeth don't look straight, right? Because of the uneven gum line. So again, on her right side, which is our, let me just undo that. Yep. So on this side, you can see the gum line. I'll just draw it here. It's like this, uneven. There's a bit of space between the lip and the gum. But on the other side, the gum line is higher. There's not hardly any space. So this is much more sort of nicer to our eye. We don't see the excess tissue. Oops. This is where the gum line of this tooth is, and this one here as well. So you can see on the left side is much more higher and also more even, whereas on the right side, patient's right side, this is lower and then it goes up like that. So it's very, even though the teeth are actually quite straight, it gives the impression that they are not straight because of that tilted gum line. It will give the impression that you have a slanted smile as well. So this is how important the gum line is in the aesthetics of it, and it's a very easy fix. It's a very straightforward fix and permanent fix as well. Again with the laser, we can remove a little bit of the tooth around there to even out the gum line. We try to make it more symmetrical with the other side as well. So maybe this tooth is a bit much. Let me just do that again. Yep. And then the other side, just a little bit maybe, just to lift it up a little bit to match the other side as well. Yeah, something like that. Then it looks more symmetrical. So yeah, just a close-up. In this case, we did a little bit of Invisalign because although the teeth look quite straight, they are not really straight. But also the gum line is definitely off here. So that's where we can do that little bit of laser just to lift it a little bit. So how the process works is you come in for the laser. We do a numbing jab around the area to numb it under local anesthesia. While we use the laser, it is numb. We do have patients that do not want to do this under anesthesia. So the interesting thing about the water lace is that it's actually not very painful. So, but you do feel a tugging sensation. So we do have patients that come in, they don't want any anesthesia, and we can do the procedure as well without anesthesia. So there is discomfort when we do that without anesthesia. You will feel a tugging sensation, but it is very possible, and that's how gentle the laser is. And there's no stitches, so if you wanted to, you could go straight back to work or back to school. Otherwise, we normally recommend to take a day off, especially like if you're doing maybe a gum or lip tie release at the same time. Maybe a day off is good, but if you really wanted to, you could also go back to work the same day. There's no bleeding in the area, so it looks kind of just like a bit of a scrape on the area that we do this gum reduction. And there isn't any bleeding, there isn't any stitches as well. So quite a straightforward procedure. So if you're thinking about your smile and thinking, why doesn't my smile look good even though I had straight teeth, or then this could be that sort of small missing link. And if you haven't done, or you're thinking of doing improving your smile, then maybe consider your gums as well as you are doing straightening. Make sure your doctor is looking at that as you're straightening as well. I hope that was useful, and let me know if you have questions. And if you're not sure about anything, then you could also come in for a consultation, and I'm happy to help as well. See you soon.